When sex is good, it adds over 20% more value to a relationship. But when sex is bad or non existent, it drains a relationship by over 70%. Hello, friends, this is Stella Sanobokelo, welcoming you to the Family Enrichment Hub, your center for family learning and for growth. Thank you for promoting and loving this channel. Thank you for sharing widely among your networks. I truly appreciate your support. Today, I want to be speaking about another storm that is happening in many marriages, and that is the issue of female sexual dysfunction. Female sexual dysfunction relates to a condition where a woman is not able to enjoy sex or participate in meaningful sexual activity. And statistics indicate that over 40% of women have suffered the issue of female sexual dysfunction in their relationships. How does this condition present itself? It presents in four different ways. And the first one is the desire disorder, where a woman does not have interest in participating in sexual activity for a prolonged period of time. And then there is also the arousal disorder, where a woman is not able to respond to external stimulation before sexual activity happens. The third disorder is what they call the orgasm disorder, where a woman is able to get aroused in preparation for sexual activity, but unfortunately she cannot reach the peak, or what they call the orgasm for women. The fourth one is the pain disorder. This one refers to persistence in a woman feeling pain during sexual activity. What are the causes of female sexual dysfunction? There are so many varied causes, and some of the factors relate to medical. For women who are predisposed to diabetes, for women who are suffering from high blood pressure, for women who are undergoing cancer treatments, women who are going through chemotherapy, women who are using hormonal contraceptives, women who are taking certain mental health medications, for example, antidepressants, will find themselves suffering this condition. And so, medically speaking, those are the different reasons. And somebody may wonder, for instance, how does diabetes affect a woman's ability to perform sexually? The medical experts tell us that diabetes as a disease has a way that it damages the nerves within your body as a patient. And when the nerves within your body are damaged, the sexual organs will not be exempted. So, in case of sexual activity, the sexual organs feel numb, and so a woman will not have any sense of arousal. And in that way, she will be predisposed to this condition of frigidity. There are also other factors that cause frigidity. And another one is menopause. We are told that the female sexual performance is largely dependent on a hormone called estrogen. During the younger and more active time of any woman, this hormone is released in large quantities. It's the hormone that is responsible for thickening of the vaginal walls and also for vaginal secretions. So when this hormone is released in high quantities, you're going to have sufficient lubrication and you will be able to participate in meaningful sexual activity. So during menopause, there's a kind of slowdown in the production of this hormone called estrogen. And any reduction in estrogen production in any woman's body speaks to a difficulty that is going to arise for a woman to participate and indeed enjoy sexual activity. So menopause of necessity will lower the libido and the interest for many women in meaningful sexual activity. There are also other factors relating to psychological aspects. And here they talk of women who are predisposed to a lot of stress at work, a lot of anxiety, they are having relationship issues with their partners. All these will predispose a woman to the issue of female sexual dysfunction. And not forgetting women who are no longer confident in their body. For instance, when you put on weight, especially in the wrong places, some women no longer have the confidence within them that they can actually deliver sexually, and this can cause them the issue of frigidity and dryness during sexual activity. There is also another factor related to trauma. Trauma speaks to the pain that somebody suffers as a result of previous pains, historical pains that they have gone through. And trauma could be related to the trauma or the pain or the damages that one gets during the process of childbirth. That too can cause a woman to suffer from the condition of FSD. And then also other traumas that relate to a woman's inability to sexually engage meaningfully with her partner could relate to issues like rape, a woman who has undergone a nasty experience of being raped, for others who were molested as children, for others who were predisposed to adult content as children. For instance, others were told sex is bad, sex is a terrible thing, sex is evil, sex is going to bring you infections, sex is going to bring you pain. When you grow up with these kind of images within your mind, within your consciousness, and you have not resolved these before you enter a sexual relationship in your adulthood, it significantly affects your ability to enjoy sex because you're still suffering from the trauma of what you were told as a child that sex is indeed dirty, it is evil, you should not participate in it. So some women actually suffer and they do not please and satisfy their partners because they are still struggling with childhood issues that they were actually exposed to. Other women suffer FSD as a result of their lifestyle. Women who are exposed to alcohol, to smoke, and to drugs will suffer female sexual dysfunction. Why? Because these substances damage your blood vessels, and anything that damages your blood vessels damages the ability for your sexual organs to receive blood, which is needed for you to attain a meaningful sexual experience. So, women who are exposed to these substances have a higher chance of suffering from frigidity. And then there is also the aspect of breastfeeding. And you may be wondering, how does breastfeeding affect a woman's sexual performance? During the time when a woman is breastfeeding, there is an increased production of the hormone called prolactin, which aids and facilitates in the production of milk. So when prolactin is produced in large quantities in the body, estrogen, the hormone which is responsible for your sexual performance, is significantly reduced in the production from the ovaries. And anything that affects the production of estrogen in your body significantly will affect your ability to enjoy and indeed participate in meaningful sexual activity. Why the issue of FSD? We talk about it because it can actually become a storm within your relationship if you do not address it properly together with your partner. FSD can actually strain your relationship. It can bring in issues of aggression, it can bring in anger, it can bring in violence, it can bring in suspicion between you as partners. And like we said at the introduction, a sex therapist mentioned very profoundly that when sex is good within a relationship, it contributes more than 20% extra value to your relationship. But when sex is absent or it is not good, it strains and indeed drains your relationship by over 70%. So that is how significant sex in a relationship is. Sex has a way that it multiplies and touches on all other aspects of your relationship. And so it's important for FSD to be talked about, to be discussed, and for people to know that it is a condition which affects very many women at different stages of their sexual lives. And so, because of this, you'll find if you do not discuss it properly as partners, you'll find yourself gearing into extramarital relationships. And before you know it, you are separating and you are divorcing because the issue has not been addressed. Is there a treatment for female sexual dysfunction, just as it is there for the men? The treatment is readily available. And women are advised, for those who have suffered trauma as a result of childbirth, to kindly seek the pelvic floor therapy, which is available to help you support your pelvic muscles so that you can be able to again engage in meaningful sexual activity with your partner. For those who are suffering from this condition as a result of the medications that they are taking, because we are told, for instance, if you're undergoing mental health treatments, for instance, you're taking antidepressants, they have a way that they also affect your sexual performance as a woman. So, together with your doctor, you can be able to navigate this issue and find a way that your medication can be adjusted to support you in your treatment, but also while helping you on the issue of your sexuality. And then the psychological therapy is available for those who are suffering this condition as a result of relationship issues with your partner, as a result of stress and anxiety. There is professional help available. Seek the support of the experts so that they can be able to explore and navigate this challenge with you and find a winning solution for your relationship. We are also advised that lubricants are available on the market, but women are advised against using lubricants which have strong scents and those which are alcohol based. Why? Because these have a way that they will distort the vaginal pH, and then again, you'll introduce other factors and infections into your health. So, before you seek out a lubricant, kindly consult with your medical practitioner. Women are also encouraged to eat foods which are rich in fetal estrogen. This is a chemical which mimics the performance of the hormone estrogen within the body. So women are encouraged to eat foods that are rich in this fetal estrogen. And those foods include the flax seeds, it includes the soya seeds, and then the legumes. Women are also advised to seek professional medical help. Why? Because the medical professionals are able to profile you aright. They will be able to understand what the cause of your condition actually is before they can be able to prescribe a certain kind of treatment. Because for some women, it could be a combination of causes. So the medical people, after they've taken your history and they have done a profiling of you, will be able to come up with a winning solution that will help you to actually address this condition of female sexual dysfunction. Friends, help is available. Do not die quietly. Do not shut yourself into a solitary world. The professionals are available and they will be able to walk this journey together with you. I want to conclude with this. Communication and openness are key in the success of any relationship. And like the Bible tells us in the book of Amos, chapter 3, verse 3, that two cannot work together unless they are in agreement. If your relationship is suffering this condition, kindly walk the journey together. There is support which is available, and do not allow this to become a storm that will ravage your marriage. Thank you, friends, for listening in. Kindly share widely, for I believe that if these messages are good for you, they will truly be a blessing to another person as well. God bless you. Catch you next week. Bye.